The program still work out. They go. The name of the program, Good Morning from Benin. Anyway, we see they watch us for across the world. The other day, the Edo State Secretary to the State Government, Secretary of the State Government, when they call Saldion Ogie Esquire. We see one this way and say break come out. They say yes, say everybody I be now. When you get thing to do with government, you must get the Edo health insurance scheme certificates to show say yes, say before you fit do anything with government. So the question come they ask, people come they ask the question, say now everybody go do am. Why this I must do am? Insurance don't be what they say person will get in mind to do if I like I do, if I don't like I do. Because this one will go ask, maybe go call people that when they say they in charge, they talk to us for this matter when they say concern insurance scheme, whether not compulsory for her to or not be compulsory. We got to talk today for here. Our friend, our brother Rock Amigo, now be the DG for Edo Health Insurance Commission. My brother, welcome to our program.
Good morning, sir. Well done. Thank you, sir.
I agree to you. I know say yes, you did very, very compliant. At least still give small distance to show say yes, we they follow the COVID-19 rule. Edo Insurance Scheme. Why people they talk now? Why it come based now compulsory something?
Okay. Thank you very much, my brother. Thank you for inviting me here to come talk on this matter. We don't did the wave since for some time about the compulsion of the Edo State Health Insurance Scheme on anybody. When we start in 2019, in fact in 2017, when the law was passed by the House of Assembly and assented into law in 2019, the technical committee started for 2017. And after 2 years, they come sign them into law, say everybody for Edo State supposed to do the health insurance scheme. But make I talk one thing for this program, all right? Sometimes when government makes a pronouncement, it don't mean say, if you not do them, he go arrest you, they go beat you. Government, they make pronouncement for the benefit of everybody. And if you look the health insurance, what they do? So if you not get money, if you get money, you fit enter into the scheme. And the commitment of a government is say making people get better health, may they come out of poverty, may they get long lifespan. Because the indices where they cause person to get short lifespan. Now say when they get problem for health, they not fit pay for their health.
This health insurance scheme now for government, what will be the purpose? Not to make government forget more money to work for us, I be now how?
Okay, make I tell you, sir. This government, they very committed to the people of Edo State.
We know that.
It's not really for government to make government take work. You know, it's a wrong opinion and wrong notion. Government want make everybody where they stay for Edo State get better health. And so for those who not fit contribute, those who not the work, government they contribute for them as we are speaking. Federal government and state government, particularly the state government, very involved in contributing for those who not fit pay. They call them the vulnerable or the poorest of the poorest. Those areas where they not feel rich. So we they pay for those people. But for
so
those
you mean say somebody fit just go hospital now? When we say you know get one health or clinical challenge, when we say no get money, you know say no get money, just go there. They take care of
there are processes before you go there. If you not get money, we get state-owned data. They call them data for mega. So they go around every local government, every unit, every ward to find out those where they're vulnerable. So they don't register them. They also get national safety net.
People don't get money now.
People will not
write their name down.
They don't write their name.
That one fall sick now free.
No, what it is now, after we don't get this data, we'll go those places where they don't mind the data from data for mega and NASCO, national safety net. Then we'll see those people who come say, okay, people where they don't register, we'll validate them not true. They really did for then we'll come register them. We'll come divide the quota across the 18 local government for the state to say, okay, these people will not register for this year if you're not sick. This is not the hospital where you go get free health care. So now federal government and state government initiative to make sure say health come to the doorstep of the people.
You never answered the question I asked you.
Yes.
Why do state government they do them? Is it to make money or be not to take care of the people? Because one thing we say yes, say when government they do, Governor Obaseki, he don't come many times say get to Igbo they call and say there's paucity of funds. Say we don't get money or we say we don't get money. We look for every means to make sure we say we get money. You understand? So we meet the needs of the people. The same math we talk and say yes, say we know the see that money we look for. The same math now you want to tell me now say government don't want this scheme to make money when it be say yes, say people they pay. You understand? Out of their salary at the end of the month, out of their people waiting for sure, they collect money for their hand and all of that. Why you come to me say no be to make money government thereafter?
Okay. Why I tell you say no be to make money government thereafter and I say as much as the health insurance is a social investment program, we also want it to be a sustainable program. What that means is that if people they go take service, people where they work, where they go take service, The ones who get the capacity to pay, they go pay. The ones who not get the capacity to pay, government go pay for them. And so the system will get sustainability, will get sustainable drive. You know, what we are doing in this health insurance is that health insurance is bigger than myself and bigger than anybody. When we come out for this system, after a long time, after years and years, the health insurance goes still there. It's not to make money, but it's to bring the people together, to collaborate with them so that they will get health needs when the need arises. So like I was saying to you, when I was talking of the poor people, when you go to register with those people, those data from Mega and NASCO, we'll collect data from there, and then when we go to those people's houses on site, we'll see where they live, with the kind of property where they live, the kind of family support where they get, all those things now we'll come put together, say those people are vulnerable, they're not going to pay for them. Now for those who get work, whether they be artisan, whether they do formal sector, whether they get restaurant or however way, as long as they earn, we go check in their earning power, and then we go advise them on which plan to buy and say, okay, since you they earn, you can pay monthly, you can pay daily.
Are you saying to be on that form of tax with that one?
No, it's not form of tax.
Yeah, because you they go and go to meet people, they can't register now. If person is sick, Thomas I do the sick now. I can't meet Dr. Rock Amigo. Say yes, say I the sick and all of that. Now me the sick. Now me you can't meet. Nobody you can't tell me say yes, say oh but can't treat yourself. Say you dey. When me say yes, say I never complain to you. Say I the sick.
Okay. You see, health not be respected of any person. The rich, the poor, the fat, the slim,
anybody
whoever,
they feel sick.
Anybody they fall sick. All right. What in Western world don't do over a long period of time and say they get everybody data. And so because most of their payment system is centralized, people they very compliant with tax. They are on they do when they call tax for benefit. So as they collect their health insurance premium, they collect tax. But our system is not as robust as that. And so that's why for the first 2 years, what we started doing, they preach to everybody, say, see what government initiative don't bring out. Now, very good initiative, make everybody embrace them. It is very transparent, all right? So when we collect premium from those people where they don't know whether they go sick, when they come hospital, when they sick, they not go actually collect money from. There are testimonials all over the places. For those who did the public and civil servants already, they have been receiving care for the past 3 months. The mother, father, and 4 children less than 18 years of age. They know they pay for hospital. If they do surgery, so for example, maybe surgery at 250,000, they go pay 10%. If they do surgery of 100,000, they go pay 10%. But the only thing they know they pay for now consultation. This 10% payment will bring to the scheme and say, may they not cause burnout. Because some people they'll say they don't pay. They want to go carry drugs, they'll carry the drugs, they'll put them for house, they not go chop them, they're not well. We want to make this scheme reach everybody, equal distribution for Edo North, for Edo South, Edo Central, and any resident who is there Edo State to say, what thing would they do now for the betterment of the people, and not to make money, but to make sure say our health indices improve, and our health sector, our primary healthcare agencies, our secondary healthcare agencies, our secondary healthcare services are well patronized and equally distributed around the state.
One challenge where MB say we go get now, MB say the centers to even access these things then, my problem. Or now 2 questions I go ask you. The first one now be say people they want MB say they get other scheme when they did before. Some people did for national health insurance scheme. Now they say it must do for this one now. You understand? Some people do when they say it already did. Maybe a wife they work for federal this thing. They don't force and say it must do national health insurance scheme. He do. Then a pikin, a husband now they work for state. They say he must do. Or some people do when be like say yes, they even do for some establishment then. They say they go still do and all of that. People when don't do NHIS, they don't do for their establishment when we say they now. Must they for say they must they for Edo State insurance scheme?
Okay. Thank you very much again for that. I want to go back small for the question where you asked whether they force them. You see, sometimes when government make pronouncements, it's not whip and hammer to say you must join the team. It is out of the commitment to bring better governance to the people. Now we take the talk, say, okay, join health. Not be say with the force. It is strongly advised to say, please join the health insurance scheme because of the betterment for you, for me, and for all of us.
And if you not join the Edo State insurance scheme, you not go get anything to do with government. That won't be forced.
No.
That they call subtle force.
No, not be forced. We are just saying, come and work with us. Compliance. Come
but
and
before
work
you
with
go
us.
work with us, you must do this.
Come and work with us. We have been talking about it for years. Come and work. It is not whip and hammer. It is say, okay, look at the program we will get. Look at the benefits we will do under. If you even see, if you are paying for a benefit, for example, under the health insurance scheme, 18,000, the benefit you get is over 350,000. There's no private insurance that does that. You know, we are more of a social investment scheme. What that means is that we dey look the people face till they do something. We are more committed with the people than whichever money we make or we not make. That's what I'm trying to make clear here. Governor Obaseki is not trying to make money with the health insurance. All he's trying to do is to bring healthcare to the people. All right, you talk about hospitals where we go utilize. We have been building about a lot of primary healthcare centers. Since when I resumed work, we have renovated about 61 with ICT platform. And so those primary health centers, we don't bring them on board. But we also know, say, for this healthcare to reach the people, now private healthcare now
most of the healthcare centers, when they are across those states, when you go there today, either they are non-existent, or if they exist, they don't get personnel there, or if they get personnel, they don't even get things to work. And that's some place, then it was maybe somebody go there, make you go do the heads. And even the one when we say they for Ring Road now, when we say what they talk about, the state government say they want to remove back money for that place. When we say if we talk about proximity, say they close to the people. Now the one we say they for Ring Road, now people feel go. Now say no, want to remove back money for that place. Carry and go where we never even know. So how person like lock your mouth when we say a house there for a big way, want to go take the health care when we say I don't carry come for Ring Road.
Okay, I will start answering from the beginning till I get to this.
No wahala.
You talk of, say, facilities where government want use, that the government facilities are not up to date. I told you that we have renovated about 61.
Now, so you talk.
But yes, with evidence, with ICT platform. And then most of the facilities what they use today for our scheme, not most, about 25% of them are private care facilities. Because governments today realize that we cannot do it alone. And we need to bring the private sector in. And what does the private sector need? If private sector get to work, you get to compensate them for the work that they do. And so that's why we are trying to reduce variation in prices, so that for government hospital, for private hospital, they'll get the same prices, so that we'll feel harmonize the service. That's what they do. So presently, we are using government hospitals that have been refurbished and renovated, and private hospitals that are up to standard.
Okay.
You say people wait.
One of the refurbished ones now, like
the one way they near you here for Okada. What do they call this place here?
So if me and you get issues now to even talk the name of the place now, how you feel say yes, say Sydney Yore go fit know the place where
no, there are over 182 hospitals accredited under the health insurance scheme in Edo State today. Okay. I simply cannot remember all the names. All of them. All right. But I know that we have renovated 61 public facilities. We have about 28 private facilities on our scheme. Most of those 28 are distributed within the metropolis, Ego, Ibobaha, and Oredo. Okay. And we know that private health center, they require incentive, they require compensation. That's where you can also retain those doctors who are working there. And so that's why we are compensating them for the services that they give.
If they do they do the pilot program now with those metropolitan local government areas there, Redo, what you call Ikobaka and you go. Why somebody like me, when you say there for Ovia Northeast, why you go tell me, say, yes, me, I must sit there, or why you go advise me to join the Edo Health Insurance Scheme? You
know, say like we talk now, pilot program. Okay. When you start, you can't start all the 18
but me, they work for sorry, they work for Ovia Northeast. Say yes, I go still join. When you know, say yes, say your pilot now for Ego, Oredo, and Ikobaka. So why me when I do for Ovia Northeast? Why I go come join?
You go join because it's going to spread across the 18 local governments of the state. The pilot was for the initial phase to see the processing on how the thing to work. Insurance is very diverse. It's not a one jacket fits all. And so because we don't know the process now for the first 3 local governments, as we are talking now, we have scaled down to the Edo South, all the 7 local governments in Edo South. And by the grace of God, before the end of the year, we'll scale to Edo North and Edo Central. All right? You must bite what you can chew. All right? It's not to say that we can take everything and in the end you are not delivering the mandate which you said you are going to deliver. And so that's why we said we'll start small in these 3 local governments. By the end of this year, now we're in 7 local government. We're in 7 local government already. Before the end of this year, we'll do the 3 central districts. Back to your question, when you talk, say we want to move our services from Central Hospital. All right, Central Hospital and cultural heritage, we don't do there for over 100 years. But you and I know, say the hospital has not been working up to speed in terms of capacity, in terms of human resource, in terms of equipment. And so a lot of things, even we don't hear say criminals don't even go there sometime in the past because they don't get personnel there. And so we are trying to look into it critically to say what is the best.
Anyway, now the insurance, now the health insurance can now go like make we narrow our discussion.
Yes.
To I know say the one will be say concern that the movement to demolition relocation of Edo State, Edo specialty or specialist hospital, maybe we'll get people where they when we say we go ask. But before I go let you come out now, I go ask you this question. What will be that question when we say I not ask you, when we say they your mind, when you first like me can ask you. Just answer the question.
How do I benefit from the health insurance scheme? All right, the way for you to benefit from the health insurance scheme, and to look into our programs, look all the various benefits we will talk so if we give into the people. You as an educated person, you can do self-registration as you sit down there, you know, enjoy our facilities, look at it, go there, critically analyze it, judge it, whether we are delivering what we said we are delivering. If not, you can come on there again, either to give us applaud or to say we are not doing well. And because we are confident of what we are doing, I'm sure your testimonials will go far and reaching to tell everybody in the Edo State that what we are doing is working well. That's the question I want you to ask.
I want to make you just hit the nail with one thing. Yeah. I'm going to go back for clarity's sake, people for know. Person where you get National Health Insurance Scheme, you get some other this thing, must he be part of Edo Insurance? Okay,
the law that guides the Edo Health Insurance says if you are either in the NHIS or the Edo State Health Insurance Scheme. All right, that's what the law says.
So if I do NHIS, must I do for?
No, that's either. So it's one of them. You can be in both of them because the benefits are not the same, or you can be in either. That's what it says. All right. There's no health benefit too much. Okay. There's health promotion. There's disease prevention. There's treatment and rehabilitation. All right. There's also lifestyle modification. So all those benefits we do not do for NHIS most likely go do for Edo State Health Insurance Scheme, and you go benefit from them.
Rock and Mego, the Director General Edo Health Insurance Commission. Thank you so much.
Thank you very much.
So yes, Edo people don't learn more and they don't see why, according to you, why they will be part of the Edo State Insurance Scheme. Thank you so much.
Thank you very much, sir.
We'll take a small break now. We'll come back just now because the matter when we say you consider this thing is still plenty where and Rock Mengo don't tell us so many minutes. We go put all of them to test. You know, but next time we go drunk on here, we go find out how it be the program or the insurance scheme don't work. We'll take a small break. No go anywhere. Stay with us.